So one of the reasons why we're hosting this webinar today is because we're trying to answer the question, why do insurance companies deny our care? This webinar is hosted in partnership between People's Action and West Virginia Citizen Action Group. So we might ask ourselves, why do insurance companies deny our care? Well, here's a little video that People's Action has put together that really just helps to put it all together into one space. It's powerful.
The health of every person matters. Regardless of our race, how much money we make, or what zip code we live in, we don't turn our backs on people in times of need. So how is it that in the richest country in the history of the world, you can lose everything if you or a loved one gets sick? Greedy executives at private health insurance corporations make life-altering decisions for the rest of us by refusing to pay for care when we need it most. This is called a claim denial or a prior authorization denial. 1 out of every 7 claims is denied, and that adds up to billions of dollars every year. When your claim gets denied, one of 2 things can happen. 1, you don't get the care you need because you can't afford to pay, or 2, you do get the care, but then you get stuck with enormous medical bills that could force you into debt or even bankruptcy. And if you want to appeal after you've been denied, you can go through a time-consuming process that the insurers intentionally make hard to navigate. So in the end, just over 0.1% of people appeal claims when they are denied. This practice hurts all of us, but especially affects Black and brown people, who are often sold the worst insurance, and people in rural America where there are fewer healthcare providers or none at all. And while the Affordable Care Act did make it easier for some people to get health insurance, 1 of every 5 claims to a private insurer is still denied under the ACA. Why do companies behave this way? Short answer, it's how they make money. And the more they refuse, the more they profit. More money for CEOs and Wall Street investors, and less care for you and the people you love. So what can we do about it? Organize. People's Action's Care Over Cost campaign organizes people nationwide to appeal and overturn wrongful insurance claim denials from private health insurers and expose the lie that corporations are here for our health. And we know that when we organize, we can win. We won't let greedy companies keep calling the shots when it comes to our health. We're fighting to build a world where everyone gets the care they need when they need it. Join us. Visit careovercost.org to get involved.
What do you think about that? Let us know in the chat what you think about that video, how it hits you. What were the pieces that struck you the most? That's right. Organize to fight back. Record profits equals denied care. Absolutely. Oh, Carol, yes, absolutely. 1 in 7. That is a very large number of denials. All right, so one of the things that we want to try to cover is just something that makes a difference between the 2 types. There's claim denials and there's prior authorization denials. Claim denials are when they deny your claim after the fact, and prior authorization denial is when they deny before you get the care that you need. Oh, looks like we have a comment in the chat. Vanessa says they've had medical procedures denied twice, and there doesn't seem to be a way to appeal a 3rd time. How can a doctor I've never seen decide about my? Absolutely. That is powerful. So sometimes people are denied the care that their medical professionals have prescribed for them, but they're unable to get that care. Or they're able to get care, they're able to get some treatment, but then they're stuck with this enormous medical bill after the fact. And it can be overwhelming. I think the statistic that I read was that a lot of I think the number one reason why bankruptcy happens is because of healthcare related debt and foreclosures. People lose their homes because of overwhelming medical debt. And if you decide that you're going to try to appeal your denied claim, they make it so complicated, so burdensome, that a little more than 1/10 of 1%, 1/10 of 1% of people go through the appeals process. So here's some numbers for you. 1 in 5 claims to private insurers are still denied, even under the ACA. And that 1/10 of 1% of people, that's the only percentage of people who bother to appeal their claims. It's because it's so overwhelming. Yeah, basically just, 1/10 of 1%, not even 1%, a tenth of that. So just to put it into perspective, the health insurance landscape is this. We've got about 331 million people in the US. A little over 90% of the people have health insurance coverage. Less than 10% do not have health insurance. So that means that most people are covered through a private health insurance company. But we still have millions of people on Medicaid and Medicare. I think the total Medicare enrollment for 2021 was around 64 million individuals. So we have millions of people on Medicare and Medicaid, and hundreds of millions of people on private insurance. So let's ask a question to everybody who's here on this webinar. How are you insured? If you feel comfortable sharing that information, post it in the chat. Name your insurance provider. Let us know if it's through Medicare, Medicaid, through your employer or your spouse. Like my husband works for Marshall, so I am covered through his insurance at Marshall. Ryan says he's got Blue Cross Blue Shield. And Mindy says Peak Health. Paula says PEIA. Vanessa says Medicaid through Unicare. Cassie has Medicaid. Marcia has Medicare and Blue Cross Blue Shield. Marcia says, we have to organize about so many issues. It can take all our time. Democracy, preservation, healthcare, and climate change. How do we prioritize? That is an excellent question. But whether you are covered by Medicare, Medicaid, or through private insurer, the denial landscape is vast. Consumers only appealed about 1/10 of 1% of denied claims. However, health insurance companies, of those appealed claims, they still upheld their original denial more than half of the time, 63% of the time. Private insurance companies deny claims more than 248 million times annually. That's every year. And that means that on average, anybody with health insurance is denied a claim about once a year. So odds are you know someone who has had a claim denial that has impacted their life. Health insurance companies on average deny 17% of in-network claims. That's huge. It's not an out-of-network denial, in-network specifically. And some companies, as much as 80%, deny those claims. Why do companies behave this way? It's because that's how they make money. And they are already getting your money. Whether it's through Medicare or Medicaid or private insurance, those payments are coming through. Those policy payments are coming through. They have a profit margin out of that already. But the longer they can hold on to that money on their interest-bearing accounts, the more they can deny claims, the more money they generate, which is why they've been having record profits. Carol says she lost the QMB plan where Medicaid paid what Medicare didn't by $4 this year. I'm so sorry to hear that, Carol. That's got to be very expensive. And I know there's a gap. There's a gap between what Medicare pays and what Medicaid pays. So how much do insurers make from claim denials? Well, here's a number for you. $260 billion per year. Let's just say they're not hurting. They can afford to take care of people. They're just not, because it's making the money. And here's right here, highest paid CEOs at publicly traded health insurance companies. Look at this. Let's look at Clover. I mean, we can go down to Elevance and still be like, 19 million is a lot to pay someone in 1 year for being a CEO. I mean, that's a lot. But just go up to the upper left there that says 390 million. Can you even imagine what in the world are they doing that's so special that they should be paid $390 million as a CEO for just 1 year? That's yeah, that's something. So they're not hurting, and they're keeping your money because they can. So I would like to invite you at this time, if you know anyone who's had a claim denial. Some of you have already shared in the chat some of your stories, but we'd really like to hear from you. Share a little bit more of your healthcare story, any denials that you or a loved one has struggled from. Let us know. Ryan says he got a denial for antibiotic treatment post-cancer. Oh my goodness. But he got it anyway. $1,000 per day for a week, and it saved his life. Wow. But his insurance company stuck him with the bill. Oh, so your dad got a denial for antibiotic treatment. Understood. $1,000 per day for a week, and they stuck him with the bill. That is overwhelming. Vanessa says, I found that if you have Blue Cross Blue Shield, the provider automatically does an appeal. But if you have Medicaid, they do not. So a Blue Cross Blue Shield subsidiary that may be managing a Medicaid plan in a state, they don't automatically do appeals. Yeah, that makes sense. My roommate, he's disabled, and it has been several times now, because he'll get new doctors and he'll try again, but they won't cover his hernia repair, and they won't cover his pacemaker, because his pacemaker is it's not life-threatening because his heart works most of the time. I know that doesn't make any sense. There's no way I can make it make more sense. They won't cover his hernia surgery. I want you to imagine a head of cabbage. Just make your hands like this, a head of cabbage. Hold it on your belly, right there at your navel. That's about the size of his hernia. But they won't fix it because it's not life-threatening. I mean, if something ruptures there, we won't be able to get him to the ER fast enough for him to be saved. And of course, you're dealing with, a septic situation at that point, but they won't fix it because it's not life-threatening. It's ridiculous, and that's Aetna. So Cassie says they had to have a colonoscopy when she first came to college and was covered under her father's Blue Cross Blue Shield. But they revoked paying for the ER visit that led up to it. Oh, wow. And it's been destroying her credit for years since. And you have to have credit in order to be able to do anything. You have to have decent credit in order to be able to do so many things, rent a car for travel. Maybe you need to move and get to do a new apartment. So you have to fill out a lease, and your credit affects your ability to rent a place to live. It can actually affect your ability to apply for jobs, whether or not the algorithm for certain employment apps bump you up or not. It plays a role, and medical debt is a big reason why people's credit is not what it could be. So here's the question. We've talked about what it means to us and what it means to our loved ones, but what can we do about it?
Organize. People's Action's Care Over Cost campaign organizes people nationwide to appeal and overturn wrongful insurance claim denials from private health insurers and expose the lie that corporations are here for our health. And we know that when we organize, we can win. We won't let greedy companies keep calling the shots when it comes to our health. We're fighting to build a world where everyone gets the care they need when they need it. Join us. Visit careovercost.org to get involved.
All right. So Ryan, would you like me to take us to the website and you can talk a bit about it? Or do you just want to talk about it?
Either way is great. I'll start talking, and if you want to toggle folks through the website, that'd be awesome. Hey, y'all, my name is Ryan Greenwood. Take he, him, his pronouns, live in Minneapolis, Minnesota with my wife and 2 kids, and great to be with you tonight. I have experienced this myself personally. A couple of years ago, I was in an accident and 911 was called on my behalf, or I got injured on the street, and the ambulance came, they took me to the ER, patched me up, and then we got home, and my insurer wouldn't fully pay for the bills. We got thousands of dollars in medical debt, and it's just an ongoing stress. And there's ongoing calls from debt collectors, and so it's a horrible situation, and it happens hundreds of millions of dollars a year, and we know who profits off of it. So we launched this campaign a year ago with West Virginia Citizen Action Group and sister organizations from Maine to Colorado, Wisconsin to Maryland. And the basic idea is we are finding people, and I see a lot of folks posting in chat who have had this experience or are having this experience of being denied care or getting stuck with a bill. And then we work with them to organize fight back campaigns. And that looks like basically 2 things. We have a set of volunteers. We call them the National Appeals Team. It's a lot of healthcare workers, people who used to be in claims collection and billing for hospitals and other providers. So healthcare workers, attorneys, and people who kind of know this field. and they volunteer to help people through the appeals process. But the real thing that impacts the denials for people is when we run public fight back campaigns, and people do petitions, they do videos, they push out online. We help them where they tell the story of the impact of the denied care or getting stuck with a bill on their health or their family's financial health. And then we ask people to contact the insurance company. We've held protests at insurance companies around the country to get them to pay for people's care. Now, as Eve said, I mean, this happens, hundreds of millions of times a year. We can't do that hundreds of millions of times, but we figure if we do it enough, and there are more folks like y'all in West Virginia, people in Michigan and Iowa and Illinois, all a part of the campaign, we can really start to highlight that this is a massive problem that people are experiencing at home, and force our elected officials to rein in the industry, to force them to take them out of the care denial business because they have such a direct profit motive for it. And ultimately, in for us at People's Action, our members' vision is for Medicare for all. We think that everyone should have health care when they need it, and somebody making a buck off of denying them care just ain't right. So that's what the organizing looks like. And I'll pass the mic to Eve if we want to go through a couple example cases. Is this the right time? Okay, I'm seeing a big thumbs up, so I'll defer to the videos where people talk better than I can about what they're experiencing.
I am so relieved, very, very relieved. The whole process has been painful and really scary for me. When I was dealing with my insurance by myself, I was told different things each time I called, and because of this, I had zero understanding of what was happening or how to move forward to get my surgery. We have in writing now approval for the surgery, which means I can move forward in planning a long trip and a notoriously long and painful recovery. It means that there is a possibility that after I recover from my surgery, I will be able to get my other medical issues under control and hopefully beat that 62.1% chance that I will die in the next 5 years. It means that I can have some more hope.
Carly Morton reached out to the campaign at the beginning of this year. She lives up the road from you all in West Virginia. She lives in Beaver and Beaver Falls. She's been between the two in Western Pennsylvania. And as Carly was starting to share, she had this condition called NMALS, the outcome of which is that she couldn't eat. And so for years, she got intravenous feeding. That led to sepsis, and the two combined to give her a majority chance of dying in the next 5 years. She's only 29 years old unless she got the condition treated. Her healthcare provider, United Healthcare, refused her surgery. They denied it. She spent months calling them, worked with a caseworker in the supportive housing community she lives in, to no avail. They were just no's. It was a brick wall. It was just sending stuff into a black hole. And, Carly really had a majority chance of dying in the next 5 years if she didn't get this surgery. And her quality of life was decreasing. She couldn't eat food. And so she couldn't get adequate nutrition and also just enjoy a core part of being alive. And so when Carly reached out to the campaign, we launched a petition on her behalf, did a bunch of social media posts, videos, reached out to U.S. Senator Bob Casey in Pennsylvania. His office weighed in with United Healthcare, and all those things put together and work with the national appeals team pushed United Healthcare to say yes to Carly's surgery. And we don't think there was, they didn't do that out of the goodness of their heart or because they had seen the light. They had gotten ample information from Carly and her doctors previously about the medical necessity of this surgery. They did this because they were starting to get embarrassed, and they couldn't really hold up the fact that they made $20.1 billion, or their parent company made $20.1 billion in profit, and they weren't willing to pay for a surgery that would let a woman have a decent lifespan and eat again. So we won that case. Carly had her surgery in July, and it's an example of, hey, this organizing works. It's also an example, we can't replicate this 250 million times. So it's an example that the system doesn't work. And we, can't possibly, as a nation, solve 250 million cases of health insurance companies profiting off people's care denials. So we need to rein the companies in. We need public policy that actually tells these companies, no, you're not going to be in charge of denying people's care because you can't be trusted if you've got a profit motive. So we're doing this organizing. We want justice for people now, but equally as important, Carly telling her story about the victory is just sharing for people who might be, think their insurance company is annoying, but feel like, I guess it's what I got. I wouldn't really want to switch to a public program, kind of showing those folks, look, your insurance company isn't just going to be annoying when you really need it, when you're really sick or injured, like Carly was, your insurance company could kill or bankrupt you. And I think that's a lesson we want people to take home before it actually happens to them, and for them to join us in putting pressure on elected officials to rein these insurance companies in.
Ryan, Carol asks, what did UHC give as grounds for denial? Do you recall?
They this is one really annoying thing, and we've gotten some additional information on this through some researchers we've been working with. So they gave other as the reason, which actually, and with no specific definition. So it was an extremely frustrating situation where they weren't giving Carly kind of clear communication on why she was being denied. And we found, working with some researchers who got data sets from 5 different states and nationally for people who are on the federal exchange for the Affordable Care Act, that about half the time, insurance companies, when they give a reason, which they're legally mandated to do, of why somebody's been denied care, they just say other, which is obviously, pretty unsatisfying when you've worked with, experienced surgeon who's diagnosed your condition and giving you, kind of a treatment, this surgery that, is life-saving and life-nourishing to be able to eat again.
Just by saying other, it makes it harder for the appeals process because you don't know how best to phrase the appeal.
Yeah, it really shows how broken the system is. I saw in the chat folks referring to appeals their friends or family had gone through, and one way to think about this is with about 0.1% of people appealing their claim denials, is that people do that because it's both a long bureaucratic process, a paperwork bomb, and because they feel like the system is rigged. And the reality is, it is. Doesn't mean you shouldn't try to fight back through an appeal, but the insurance companies both pick the appeal boards and they pay them. So it's a little bit like if you were playing a game of basketball and the opposing team actually decided who the referee was, and they paid them. And then, according to the stats that I think Eve showed earlier, the referee across the country that is paid for and selected by the insurance companies rules with them about 60% of the time, even though the small number of people who go on to an external review process through a public authority, another 30 to 40% of the time, the appeals that the claim denials that were upheld by the insurance company paid people were overturned by a public authority. So it really shows that the system is rigged, and it's rigged for people not to take action to fight back, and to kind of keep it in the hands of the insurance companies who profit off of denials of care.
So Ryan, other states, other organizations, including People's Action, have done demonstrations and actions, like direct actions, to help bring awareness to and hold accountable insurance companies and their way of denying claims to pad profits. They're profiteering off of our health care. Could you tell us a little bit about that?
Absolutely. Yeah. We think, we want to fight back. We want to help people win their individual cases of denials by helping them appeal and running public fight back campaigns. And we think that's important work. Even as we do that, we think it's important for us to directly go to the insurance companies and make demands. It's a really sad thing when you start to track these insurance companies that you notice that they frequently and in a highly formal way report in detail to the shareholders of their companies. So they do annual meetings for shareholders. They do investors days, these really fancy events where they bring in investors to places like New York to talk about the profits that they're making and what they'll do with their money if they get invested in. And then they have quarterly earning reports where they go in detail on their profiteering. And they do not have that same level of accountability with the lives that they ostensibly insure. And they don't tell us how many in a given plan, unless they're forced to in some states or for some ways that people get healthcare. They don't tell us how many times they deny people's claims. We know from research it's between 1% and 80%. They don't tell us how many times people die as a result of those denials. They don't tell us if there's racial bias or gender bias, or if people on lower income get denied at a higher rate. They don't tell us how much money they make out of denying people care in their individual plans. We know the aggregate figures for the country, that 260 billion, but we don't know plan by plan who's worse. And so we do protests and direct actions to go directly to the insurance corporations. We deliver them letters outlining the human impact of that care denial. We tell them stories about that. And if they won't meet with us, then we go right to their front steps and we talk with the media and make sure that TV news, newspaper, websites, all the ways that people organize and get information, that they're hearing that specific health insurance companies, United Healthcare, Cigna, Aetna, Blue Cross Blue Shield, they all do it. They all deny people care, and they've all been unwilling to take responsibility. So we think that public pressure helps kind of wake folks up to say, oh my gosh, I thought it was just me. No, this is actually everyone. And we want to use it to wake up our public policy makers, our elected officials in Charleston and in Washington, so that they understand there's public outcry and people are calling a whose side are you on moment. And are you standing with the people who profit when we stay sick or injured, or are you standing on the side of the people who need basic medicine, surgery that they and a medical professional say they need so they can get care?
Thank you so much, Ryan. Marcia says, are there specific bills already proposed in Congress or legislatures? Do you know which representatives are supporting such needed legislation? That is an excellent question, because if we know who's supporting the needed legislation, we know who isn't, and we can help drive messages and emails and phone calls to the right offices. Is there anything that you could, Ryan shared a link.
Yeah, I'll share a link if y'all can post to the main channel. It's a great question, Marcia, and what I shared and Eve will be transferring over is a federal policy agenda. So People's Action, this group of 40 community organizations, we had our national convention in DC, where we brought people together from around the country, many of whom who had experienced these care denials, and they agreed on a policy agenda that we went and did meetings with staff and elected officials on Capitol Hill. And so that link lists a series of bills and actions that don't have bills, but we think would be fundamental. Things like total transparency. So these companies are mandated to report the human cost of their denials and breakdowns by race and gender. Things like taking the appeals process out of the hands of the insurance companies so it's not rigged. And doing an audit on the insurance companies and going back and looking at all the care that they denied and making people whole. So, these are pretty bold measures that, honestly would reduce the power and profits of the private health insurance corporations. And, we think that money needs to be reinvested in public programs that work. Things like traditional Medicare, where there's not a privatized Medicare disadvantage, but there's nobody with a profit motive to say no. Or things like in some states, Connecticut and Maine, they don't have privatized Medicaid. So for folks who are on Medicaid, you can get the care they need, and no investors making an extra million or a billion or tens of billions because they're shooting down care for people like you. So concepts like that, it's going to take a lot of political pressure to make it happen. And so I think the next step that Eve will be talking about in a minute or here is organizing a nationwide day of action on October 11th. So people from Maine to New Hampshire, Colorado, Wisconsin, Iowa, Chicago, Detroit, all in the same day are going to be taking letters demanding changes to private health insurance corporations and protesting outside if they get told no. And I know you all are looking at one in Charleston as well, that folks all over the state and region are encouraged to make it out to.
That's right. So if anybody here is as angry as we are about how corporations are profiting in a predatory way off the care that people need, it's ridiculous. It's unconscionable. If you're as angry as we are about it, and want to get more directly involved, we want to invite you to participate in our October 11th demonstration. And who here is interested in taking more direct action? We want to do a peaceful protest demonstration. It's going to be peaceful, but it's going to be loud, because we want them to recognize us, to hear us. So that is our goal, to be loud so they can't ignore us, but be peaceful so that we can protect our people, make our voices heard. Who here is ready and willing and wanting to be part of an event on October 11th? Please put claps or pluses in the chat. Just let us know so that we can coordinate with you. We're going to send anyone who is interested a private invite link for a Zoom training, so that we can get everybody together and talk about best practices, safety, etc., and what we want to say to the insurance entity that we will be targeting on October 11th. Thank you, Vanessa. There are things you can do even if you will be out of town. We will be sharing posts on social media, and we would love for people to help amplify those posts. So if you have any questions as to where to look for us on social media, look for us on Facebook, look for us on Twitter, look for us on Instagram. It's at WVCAG, at West Virginia Citizen Action Group. Just find us there, and we would be greatly appreciative of your online presence if you cannot make it in person. Maine and Connecticut do not have privatized Medicaid. It's entirely public. That is good, because West Virginia, though, we have ours privatized. And like I said before, my roommate is in an active case denial right now with Aetna. So we very much would love your help, your presence, and if you could, invite others to join us. So please put in the chat if you're interested in being part of this event. We've had a couple of people post that they are, and if you're interested in being a digital activist to help promote the event and help spread the word about the work we're doing, and other people who are currently fighting claim denial cases that need our help to amplify their fight, we are hosting a digital advocacy, a digital activist training next Monday, October the 2nd at 6:30 p.m. We would love for you to attend that, but please reach out to us and we will send you a link to attend our October 11th demonstration. Very much looking forward to seeing everyone there. Marcia says, I'm willing to contact elected officials and donate contributions to some strong supporters campaigns on that day, but will be unable to attend in person. That is fine. That's okay. If you would be available to help maybe share posts on social media, amplify those, that would be wonderful. Thank you so much. And we will be in touch with you via email and hopefully see your shining faces on October 2nd and maybe a few of you on October 11th as well. Thank you so much.